much of my interest in PPPs has actually been more in public, private and non-NGO joint working and collaboration. But today I want to restrict it really down to contractual-based ones, which are more consistent with the World Bank and other definitions. Just get this. Okay, so we've only got about another 33 minutes before lunch, so I'll try to maybe skip a few slides if you don't mind. So as in the introduction was said, looking at the consequences of using PPPs, because I think too often we look at what are the upfront, these are the reasons for using them, but we don't actually look at the wider implications that they have for things like the social development goals, etc. So some reasons for the rise of service-based PPPs. We've got the traditional new public management, the move from the perception from public as a provider of services to an enabler of services, where they collect the funding for it, they pay for the services, they set out a specification for it, they ensure the protection of the users of the service, but they do not necessarily provide it themselves. So that whole philosophical background, and again, lots of people have written about PPPs and new public management in the past. Big reasons for infrastructure PPPs are budget enlargement. And I used to have arguments with people saying, no, it's all about efficiency. But I think the proof is in the pudding in a way. As soon as when the international accounting standards changed and PPPs, more of them were brought on balance sheet, in other words, the government showed them as expenditure in the current year rather than hiding them, what's happened in places like the UK, the number of PPPs has actually, I think, gone down relatively quite considerably. I think also the interest in the new rules for the PFI2, again, they've suddenly changed how they account for capital, so it's spread out over the life of the project, just like an ordinary public expenditure, capital expenditure in a way, rather than being upfront, which again, you think, well, what effect does that have? And amazingly, it also counteracts the budget enlargement influences. Another thing about PPPs was the apparent tax burden, where you could get fiscal illusion, where in the early days, if PPPs are more efficient, which hopefully most would be, then they would decrease the long-term expenditure/tax GDP ratio. However, if they're less efficient, which I would think some of the early, particularly the early post-1980s PFI-type PPPs, if they're less efficient than other sources because of funding, etc., then they actually raise the tax burden over the lifetime of the project. But these reasons don't really apply to services, because most of the services PPPs will be in current expenditure. So I don't think these are the same motivations for services as you would have for traditional infrastructure in some countries. So moving on to the more traditional reasons then for PPPs, it's about improving the efficiency and effectiveness, because you're bringing in the disciplines, incentives, skills and expertise of the private sector and releasing the so-called potential of the public sector. Very, very old, but the same argument is consistently being brought forward. There's a large push in places like China, East Asia, etc., on PPPs, and again, similar arguments have been brought through. And if this is correct, then it'd be very hard to be against it, no matter what your stance was, because it's going to be allow more services to be provided for the same cost, or the same services to be provided at lower cost. So efficiency and effectiveness are hard to argue against. But there's also been a move towards outcome-based policy, again, rather than being concerned about providing the provider enabler. Outcome-based, from historically, we would look at how much do you spend on clean water? X million. That's good. You double the amount, you've doubled the effect on clean water. Well, have you? Then the output measures, how many kilometres or metres of water pipe have we put in, towards more outcome-based policy, which is really how many people have got clean, sustainable water in their houses, or whatever the outcome you're really interested in, and less concerned with these other measures. So I think this move towards more outcome-based policy in some countries, some places, is again a push towards some market PPPs. Another reason is simply the search for markets. So companies will go to foreign countries, other countries, exporting to expand their market. But often the big market is actually in their domestic backyard. So there's a big pressure for companies saying there's a huge market here of, 30, 40% of the GDP. How much of that can be made available in a way for public companies? And the last two are other issues, I think, some forces for PPPs. And I should say, as a general supporter of PPPs, I must say, but I do think we need to look at both sides. You can never get a one-handed economist because they always fall over, because they always say, on the one hand is this, on the other hand is that. So if you're tied to one hand behind, they'll automatically fall over. So I do think we need to really more clearly look at the pros and cons of PPPs rather than just looking at these perceived advantages. So looking at changing the nature of service provision and personalisation in a little bit more depth, there's a rise in recognition of the complexity of issues. Even somebody looking for a job, what affects them? It's housing, healthcare, childcare, local job demand, social networks, etc. Most issues are quite complex. Can a single agency actually deal with the complex issues that are faced in society? And that's a big problem. So a single agency in a government cannot do it. So therefore, how do they work in partnership with others? And others who may be non-public, NGOs or private, who may be better equipped to provide these services jointly. Secondly, there's maybe multi-dimensional disadvantage requires multi-agency and or multi-service responses. And again, how do we best coordinate and collaborate? And are PPPs the best way forward? And the argument I'd make here is sometimes service-based PPPs are the best, but other times they're not necessarily the best. And we'll come on to some of the reasons why shortly. Another thing is that many welfare services are concentrated in the most disadvantaged groups or areas. And the problem with a contractual PPP is often it's fairly rigid. And secondly, so you cannot respond to changing needs very easily or very quickly. And secondly, I think a big danger is that PPPs are organized organization to organization. And yet, one of the fundamental pillars of SDG, social development, sustainable development goals, is the social pillar. And social pillar involves local people being involved in the development of services, etc. And the danger is that we have organization to organization, and in effect, they cut out the main part of the users because they're concerned with legal jargon, legal agreements, etc., and they do not actually pull on board the views adequately of local people and local users. And there are other things like persistent demands, which demographics, which affects most of the world, except currently sub-Saharan Africa and the Gulf, perhaps. But most of the rest of the world is aging. But I'll skip the next couple of slides because of time. So the next thing was, we'd say, personalization of PPP and PPPs. Personalization, again, is, I think, something that does influence sustainable development goals and also policies. But I've taken an old policy here. Personalization means that people are getting individualized policy support. So it's not one size fits all. It's very much what are the needs of individuals or groups and how do we actually better deliver that. And that means people are more involved in how services are designed. A bit like Amartya Sen's capability approach. You need to give people voice when they actually ask what types of services are provided. It's what do people actually value, not necessarily what an organization thinks that they value. So we need to get people involved in how services are designed and how people receive support that's most suitable for them. And we need to balance this against other factors such as effectiveness and efficiency, etc. We also have to help people and professionals to work together to manage the risks and resources. And how do you get people-centered services which change when people or the needs change? And that, again, there are problems here with service-based PPPs if they are long-life ones. Over 7 years is a lifetime. Somebody entering school age 5, they'll have finished primary school by the time the PPP finishes. So we are talking about even a 7-year PPP is often too long. But if we take a legalistic approach to PPPs, that is what we will reduce the flexibility. So, individual, well, I was going to say about do we need good evaluation and monitoring of PPPs to ensure that we can distinguish the bull from the substance, but we're also going to say, well, how do you personalize the service for such in such an area. Now the problems, 2 minutes, okay. So some of the problems, well-known problems, written about lots of times. PPPs can force people to maintain services and infrastructure, but locks them into a particular type of provision. Where is this about responsiveness to community need? May tie into inappropriate technology. We've talked about, 5G is coming in 2020. That's 2 years from now. You have a PPP today. How do you actually allow that to give you a flexibility of different types of services provided in different ways that will arise from G20, G5 throughout the globe, including in places like Africa and elsewhere. I'm just using 3G, but the same thing with the mobile phone. And in fact, some of the schools in early UK PPPs did not have internet in the contracts at all. And this happens, technology continually changes. We may cause cuts in other services. You have to maintain your legal obligation to PPP, so therefore what you cut whatever you don't legally have to oblige. They may also influence other policies, which I won't go into at the moment. So basically, there are a number of other problems, transaction costs, etc. But there are many key success factors. Clear, agreed strategy, transparency, rigorous monitoring, evaluation, and the building of trust. And do we build trust best through a legal system of PPPs or not? In some cases, the answer is yes. In fact, in a small local community, you may often find where people, if they fall out, that falling out, that disagreement will continue for many years or decades in the future. And in those cases, maybe a strict legal definition where we all agree that we've met the legal definition is better than a more informal one where people can actually have misunderstandings and then fall out and reduce trust in the future. But there may be organisation complementarity in organisations, so how do you actually operate PPPs on the ground? And particularly when you get local communities, maybe local NGOs, etc., may be the ones that are able to take into account the local circumstances better and be more flexible. And how do we get that if we have a more legalistic type PPP? Now, the last slide then before I'm completely stopped. We need to think of PPP, service PPPs, as a series of balances, as a quality of service. Very hard to measure quality of service versus efficiency. You can cut the cost of a service, but what if the quality reduces? Efficiencies, are they achieved by actual improvement, working better, working smarter, or by cuts in wages and conditions, in which case I would call that an illusion of efficiency. All you've done is reduced labour conditions. Also, we've noticed, big drop in trade union influence. Biggest area of trade unions, of course, is public sector, and PPPs in services will have an influence on trade union as one of the social partners' influence. Economies of scope, scale versus diseconomies. But innovation is maybe the last one. Even restricted use to protect users. So what often happens is you put into restrictions to the PPP, which in effect means they are not as innovative as they could be, because even a black box approach, taken one example from the UK of the work programme, actually contained so many restrictions that actually it inhibited innovation. But at the same time, if you put out PPPs that are large-scale ones, and I would say, again, UK work programme where only multinationals could really apply for it, large-scale companies, you've got monopoly power, and again, you inhibit innovation then. And lastly, coordination then. How is the best to get the coordination for the difficult problems that face people? How do we get involvement of social partners so we get responsive services? And is intra-PPP coordination the most effective way, or are there other ways of PPP where you can get better intra-organizational coordination? So thank you very much.
Thank you very much, Ronald. I really like that thought about the complexity of PPPs, which requires a cooperation not only between the public and the private sector, but also by including civil society organization, as well as asking the recipients of these services as well. And I think there are some approaches of that, but that would also help in terms of deciding what is actually efficiency. Is it just cost reduction, or is it quality improvement? So very interesting elaboration. I think we have time for 2 brief questions. Yes, please.
Very enlightening presentation. Can I ask about the public-private partnership in relation to health? Any efficiencies, effectiveness? Does it work?
I think it depends very much on the PPP, and it depends on whether you're talking about the full infrastructure and hospitals, services, etc. And there are pros and cons. And in fact, I was talking to somebody, a doctor in a UK hospital in a PPP one, which opened last December, who's already noting some of the problems because the users, which in that case means the medical practitioners as well as the patients, were not properly consulted. And the result now is that they have a slightly inadequate building for the next 20 years, which is how long the contract goes. The thing about things like medicine is, as the way you provide services change, does a PPP allow you the flexibility to incorporate those changes in service? And there may be quite fundamental ones of, instead of treating people in single rooms, you treat people in multiple wards, or you treat people in different ways. And does a PPP allow you that flexibility? And I think we've got to be very careful about the way you approach it, because one way the UK is you specify everything in advance, in which case you've cut all flexibility. Another way is to have some sort of arbitration agreement where if you need to change things in the future, you can actually change it. I'll give you one tiny example from a health service in the UK, is that they forgot to put in the contract that twice a year the clocks change. And they wanted, for the life of the contract, they wanted £50,000, so 55,000 euros for the life of the contract, to change the clocks twice a year, because it was not written in the contract. And that shows you the format of the way you do it, as well as not properly consulting. But I can maybe talk to you about it later.
So please remember, if we all help and do a little bit, it will make a big difference.